Health and illness. Asking about health. Health is the state of the body. When doctor wants to know about a patient's usual health, they ask questions such as what is your general health like and how's your health generally? If you are in good health, you are well and have no illness, disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. Not ill, fit, healthy, fit and well, well, very well, in good health. Ill, unhealthy, unfit, unwell, not well, not very well, poorly, in poor health. Sickness. Sickness has a similar meaning to illness. It is also used in the names of a few specific diseases. For example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. Patient says, I was sick this morning. Possible meaning, I was ill this morning, I feel unwell this morning, I vomited this morning. Patient says, I feel sick. Possible meanings, I feel ill, I feel unwell, I am nauseous, I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. Recovery. When patients return to normal health after illness, they have recovered. We can also say the patient made a good, full, or complete recovery. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. Deteriorating. We can also say that the patient's condition improve or deteriorate. In speech, we often use the verb get to talk about change. Get over an illness to recover, get better to improve, get worse to deteriorate. If a patient is better but then gets worse again, the patient has relapsed. Another word for improvement, especially in recurring conditions such as cancer, is remission. Get over the illness very quickly. 2 years later, remains in completely remission. Part of the body 1. Part of the body. Most external parts of the body have ordinary English names as well as anatomical names. Doctors normally use the English names even when talking to each other. There are a few exceptions where doctors use the anatomical name. These are shown in brackets below. Jaw, mandible, neck, shoulder, armpit, axilla, upper arm, elbow, back, buttock, wrist, thick, calf, leg, chest, thorax, breast, stomach, tummy, abdomen, navel, umbilicus, hip, groin, inguinal region, knee, patella, kneecap, shin. Lip means arm, upper limb or legs, lower limb. The trunk is the body excluding the head and limbs, referring to parts of the body. When patients speak about their problems, they often refer to a part of the body. I'm having trouble with my hip, shoulder, or knee. The doctor often needs to ask about a part of the body. Do you get any pain in the chest, stomach, back? Or do you get any pain in your chest, stomach, back? Describing gradation of pain. A patient is telling the doctor about his back pain and the parts of the body it radiates to. It starts in the back, then it seems to go into the right buttock and down the back of the right thigh to the knee. Parts of the body too. The abdomen. The main organs of the body have ordinary English names, and doctors use these words, but when an adjective is needed, they often use an anatomical words. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example, the pancreas, have no ordinary names. Pancreas, duodenum, gallbladder, liver, right kidney, left kidney, spleen, stomach. When doctor talks about the main parts of the digestive system, they use the words bowel or intestine, the small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctor may refer to the anus and rectums as the back passage. The chest. The chest, thorax, contains the organs of the respiration and the heart. The main parts of the respiratory. The main parts of the respiratory system are the airways and the lungs. The left lung is divided into two lobes and the right into three. The airways consist of the larynx, the trachea or windpipe, the right and left bronchus, and the bronchioles. The chest is separated from the abdomen by the diaphragm. The pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called the ureter on one of each side. The ureters carry the urine from the kidneys to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urine passes down another tube called the urethra to the outside. Functions functions of the body. Eating. You're hungry. You're in a restaurant and the waiter brings your food. You smell it. It stimulates your appetite. You want to eat. Your mouth waters, filling with saliva. You take a bit of the food. It tastes good and you shiv it and swallow it. Swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time before vomiting all the food you've eaten. Sometimes something has disagreed with you. The five senses. In addition to smell and taste, the senses include sight or vision, hearing, and touch, also called sensation or feeling. To ask about the sense, doctor use the question, what is your sight, hearing like, or is your sense of smell, sense of taste normal? To ask about the sense of touch, doctors talk about numbness, loss of sensation. Have you noticed any numbness in your fingers or toes? Other functions: speaking, walking, breathing, respiration, urination. Urination means urination, defecation, menstruation. Birth, speak, walk. In all, breathe in, take a breath in, take a breath in, exhale, breathe out. Urinate, micturate, pass urine, pass water. Defecate, pass feces, pass stools. Menstruate, have a period. Noun, speech, gait, breathe. Urine, feces, stools. Menstrual period, monthly period. When talking When taking a history, doctor can ask, do you have any trouble, difficulty, or problems walking, breathing, passing urine with your speech? Do you have any pain when you breathe in? When auscultating a patient's lungs, the doctor tells the patient, take a deep breath in, hold your breath, then breathe out completely. Less common functions. There is something we do less often. When we are hot, we sweat. When we are nervous, we shake. When we are sad, we cry. Doctors can ask, do you swear or shake more than usual?